Hi, everybody. Thank you for being here.
Hi, guys. Dr. Jeff here at Smart Plastic Surgery. Bring those questions right in here.
Okay, perfect. So, Queen of Persia, can you arm lipo with BBL and lipo 360?
Absolutely. So we do this pretty commonly. So we're adding arm lipo to a 360. We usually do the 360 with the BBL. That's where we harvest all the fat that we're using for the transfer. Adding the arms to that is very straightforward. And sometimes we do arm liposuction, sometimes we do an arm lift, depending on what the patient needs. So we can easily do that.
And there are two different procedures, right? Arm lipo and the arm lift.
Done exactly, exactly. So the lift is done if you have extra skin that needs to be removed. So that's the arm lift that we call a brachioplasty procedure. So either of those can be done in conjunction with a BBL, not a problem.
Perfect, thank you. And Red Spice 86, she's like, I see a lot of people saying you can take CBD gummies after surgery. Is this true?
That depends. You know, I don't think that presents a real issue. For me, the real issue is nicotine. So nicotine in the form of cigarettes, cigars, things like that, cause potential problems with healing and with tissue survival after BBLs, after tummy tucks, etc. Products like CBD I don't really have an issue with. They don't create difficulties with healing. But still, I would hold off on taking any of these products for at least a solid week after surgery so you're well on your way to healing and we know that you're doing fine before you venture out to do that.
Perfect. Sinath C, she says, in Miami for exactly 10 days, including surgery day, will I have a faja on before my flight?
After what procedure?
So okay, Sinath, if you're looking the live,
I'll
please,
give you a couple.
Yeah, you can send us what procedure are you having.
Okay, so I can summarize it quickly. All right, if it's a breast dog, not a problem. Definitely when you leave the building. If it's liposuction or BBL, also you'd have that on when you leave the facility. But if it's a tummy tuck procedure, we have drains that stay in place for 2 weeks. Okay, so I'm really strict about that. We want to keep them for 2 full weeks. So you're put in a binder garment that gives you compression around the mid portion. And when the drains come out, that's when we put you in the actual compression garment or faja. So depending on which procedure, I think I've covered most of the procedures. The faja would be for all of the procedures except for the tummy tuck. For the tummy tuck, we wait until the drains come out and then we put you in it.
So talking about that, the real caramel bee, they don't play about nicotine. And I think it's very important talking about how important it is not to play about nicotine with one of those procedures.
Right, so she's asking about nicotine. So that's specifically one of the things that we want to avoid, preferably 3 to 4 weeks before surgery and 3 to 4 weeks after surgery. What does nicotine do? Well, it causes blood vessel constriction. So the vessels get really, really tiny and they really constrict. And when they do that, we have decreased blood flow to the tissue. That's decreased blood flow to the abdominal flap. All right, after a tummy tuck procedure, that's bad. Decreased blood flow to the breast after, say, a breast lift, or to the fat cells after a fat transfer BBL. That's bad because all these cells can die. So we can end up with open wounds, poor healing, bad scarring. So we screen for nicotine, and we cancel people if in fact they're positive. So we just want to avoid that because the best patient is someone who's not smoking for 3 or 4 weeks before and after, so we don't have to worry about these types of complications.
And Dr. Jeff, I think like sometimes, people hear like, oh, nicotine, and they think it's just like, oh, it's because it's bad nicotine. No, it's really serious and critical, like the results. It could be like a total disaster.
Absolutely. And a number of months ago, I had a patient who came in and said, no, I am not smoking. I just use the nicotine patch. So we canceled that patient immediately, okay, because the nicotine patch is still nicotine. It's going into your body through a different mechanism. So nicotine in any form
the healing is
bad.
Like horrible
It
healing.
can cause major complications that are all avoidable. You know, so why would we not want to have a great result? What we have to do is avoid smoking and nicotine patches and all of that. Okay. Absolutely.
Thank you for participating. And how long do I have to wait for Lipo 360 and BBL if I had a tummy tuck on May 31st, 2023?
All right,
good question. This is Terry Huggins.
Thanks for your question. So in most cases, we're going between, say, 6 and 12 weeks. So about a month and a half to 3 months, depending on the procedure. So depending on how you're healing, depending on how your recovery has gone, it could be as little as potentially 6 weeks. But sometimes it may take longer than that. It can take up to 3 months before the next procedure. So again, I always say that we individualize our care. We individualize our treatment plans for each patient. So everyone's a little bit different. Okay, so for this patient, it might be 6 weeks, and for the next one who's had the same exact procedure, it could be 10 weeks because she's just healing a little bit more slowly for whatever reason. There might be comorbid factors like medical issues, diabetes, different things like that that all play. Higher BMI, right. So there are so many different variables that we take into consideration with each of the things we do before surgery to optimize the recovery following surgery. So, you know, it's a tricky question, but we have to take into account each of these things, other medical issues, BMI, smoking history, different things that can all affect the healing process and the recovery period. But that's a great question. So the short answer is 6 to 12 weeks.
And I have a question from Caitlin. When can I use the tanning bed after lipo BBL?
When can you use the what in bed?
Like a tanning for
a tanning bed. Right. So I'm not a huge fan of tanning beds in general, but for really
you understand that
I understand the need. I understand the need, but in
Some
a
of
place
us
like
we need,
I'm not sure where she's coming from. In Miami, we don't use tanning beds too often, so I'm not sure what part of the country she's from. But having said that, I'll tell you what I tell everyone, which is that we allow, even though recovery periods could be a few weeks or a few months, the full healing process for most things, and certainly for scar maturation, is a full year. Okay, so what I prefer to do is protect the scar from the sun for a full year. Okay, so if you want to hop into a tanning bed and put, you know, a strip of tape or you know, a Band-Aid or different things over the actual incisions to cover them, well, then you're not exposing them at all. So that would be
And
safe.
it could be an interesting tan, Caitlin. Hi, Caitlin,
It would be
it
would be an interesting tan line, perhaps, but that's what I would ask you to do. I definitely do not want the direct sunlight or tanning radiation to hit these incisions directly for quite a while.
Perfect. So let me see. Who else? What other questions? The real Caramel B, get in contact with us. And do you both doctors, this is a CRS 42204X, do you both doctor use drains after BBL?
I never use drains. I don't think Dr. Shanklin does that either. There's just no reason for drains after BBL or after any breast surgery. I typically only use drains for tummy tuck procedures.
Thank you, doctor. And let's see what else we have here. Andrea Pop 82, I'm having surgery of lifting with implants at your clinic September 21. Are you my doctor? Andrea
I could
Pop.
be. If you want me to be, I'd be happy to be.
And if you want to make sure, just
you can just
send
call
us
the
a
office
DM.
to confirm.
Yeah.
But I'll likely see you before that, the day before or so, but I'd be happy to be involved, obviously.
Perfect. Well, what else? Let's see. Wait. You can do an arm lift with a BBL. The arm lift is the one that you guys have to
that's
cut.
the brachioplasty, right? So that's done with an incision and the scar. It's kind of like wearing a jacket or a shirt where you see a seam high up under the arm. So yeah, we do that pretty commonly with the BBL procedure. We combine it tomorrow. We're combining it with the tummy tuck procedure. So it's very common. It's a great way of improving the contour of the upper arm in patients who have excess skin. Liposuction alone will not accomplish that for you. But the answer to your question is absolutely. We combine BBLs and arm lifts all the time.
Perfect. So that's for the notorious KEA. And wow, we have an interesting crowd today. So Marcaustistical amazing. What about marijuana? Is that okay?
Is it okay in what setting? You mean post-operatively or pre-operatively? I mean, ideally, we try to not, advocate different types of medications or for what purpose you're using it. We talked about nicotine at length
What
already.
if it's medicated?
Well, that shouldn't be a problem.
Yeah.
And again, that doesn't have healing effects the way nicotine does.
Correct.
But ideally, we'd want to stay away from a number of different herbal things, and including that for at least a week or two following surgery.
Okay. So what if you're having a combo procedure that includes tummy tuck? Do you still use a compression? That's a very good question.
A combination procedure with a tummy tuck. Right, so we always use compression. So with a tummy tuck, we're using a binder, right, that wraps around the torso, okay? But not the faja, not the compression garment. I guess that's kind of a misnomer because the binder really is a compression garment in a sense, but what you're talking about is really kind of the suit garment. So that we use following removal of the drains. Okay, so you would definitely be using that following that procedure, and really every procedure we do, whether it's an arm lift, liposuction of the face, the body, we're always going to be using compression garments. If we do a BBL, we're typically doing lipo 360, right? So we're removing all the fatty tissue, the front, the back. So we're definitely going to go with the compression garment to each of these areas, but we're not going to apply, significant compression to the buttock region because we don't want to apply force to those areas. So you can be we have special compression garments that apply compression to the body, but not to the buttock region.
Correct. Yeah, like the chin lipo garment.
Exactly. So we'd have a strap that wraps around to apply compression to the chin, the neck. So each of these areas are addressed with these different garments, and that's actually a really critical part of reaching the end result that you're looking for.
And this question is also in the same realm. Is Shaina or Sinath C, how soon can I get it in a faja when I'm getting a tummy tuck and BBL? I know I'll be in the binder first. Good. So she's asking.
So we're almost there, right? So it is similar. So again, it will be after the drains come out. Okay, so it will be after the drains come out at 2 weeks.
And normally, normally the drains, they come out
at 2 weeks.
At 2 weeks.
Right. So as soon as they come out, the minute they come out, boom, we put you right in that garment. All right. But don't worry, because the binder gives you the compression that you need during that early time frame.
Okay, this is a very interesting question from KAVCAV200. Will getting just lipo 360 give the illusion of a bigger bun?
Well, it can.
It can.
Okay, each patient is different, and it actually can, and I'll tell you specifically when it will.
But not all the time.
What's it?
But not all the time.
But not all the time, right? Sometimes, we may need to do a tummy tuck. We may need to, may have extra skin. But your question is a good one, because specifically, if you remove a lot of tissue from the lower back, okay, we have the buttocks that kind of come up like that, right? And we have that V at the superior portion above the buttock region. When you reduce that significantly, it does give the impression that the buttock is more prominent, has more projection. So aggressive liposuction, again, it depends on the person, can actually accomplish that. So we'd have to send a photo, come see us, and we'd be happy to talk to you about that.
And also the amount of fat that you can get out, right? According to the law, like you can just get like 4 liters. So if it's more than that, probably.
Exactly, right. So people come in, if you're 800 pounds, it's gonna be a problem, right?
Yeah.
So we can only remove 4 liters. Here in Florida, 5 liters in other parts, of the country. There are different regulations, but it's all regulated by the Board of Medicine and also by the American Society of Plastic Surgeons. So we go with guidelines that make sense, all in attempt to do
maintain
safe surgery.
Yeah, safe, exactly.
Right, so safety is our priority, as I always say. But 4 liters of liposuction is a significant amount. And again, you can actually get increased, the impression of it would actually be real increased projection by doing the liposuction of the lower back and the rest of the torso.
Oh, wow. So I stayed for a week and got my breast done in January. Dr. Chamberlain pushing my day back because I had nicotine on my system. That's a safety reason.
Right. So we will move patients' surgery dates back. So by having nicotine in your system. So he and I are on board with that completely.
Okay.
As should every plastic surgeon across the country.
Yeah, I think we touched this subject about marijuana, and it's but I don't know if you want to just the real Reina XO can use more marijuana up until procedure day, I guess, when getting a BBL.
Again, like I try to hold off like a week before because it could have some other interaction with some other medication. Every patient is different, so I can't go out there and say, sure, it's good for everybody, because I don't know what other factors are involved. I don't know if there are medical reasons for using it. I don't know if there are medications that you're taking that could have a compound effect with marijuana. So, so that would really be on a case-by-case basis. The safest thing is to minimize the use of things like that, like herbal things, other herbal, like ginkgo biloba, some of these different agents cause bleeding. So there are a number of different things that we want to avoid. And typically we send a packet out that has all these different, Motrin. Normally it's a great medication for inflammation, but don't use it 2 weeks before surgery because it causes bleeding by knocking out your platelets. So there are a number of things that normally are fine, but before surgery or after surgery, we have, suddenly, things change and we have different guidelines. Again, to keep you safe, and so we don't have any bleeding, so we don't have any tissue loss, so we don't have any complications. Because if you take the time to do things the right way, most of these things are avoidable.
And then you don't have to feel like that week if you lost a lot of, if you bleed
Exactly.
a lot after the surgery
Exactly.
and the pain and all that
Exactly.
stuff.
But we don't anticipate any major bleeding after surgery, but there's always a little bit of bleeding during surgery,
Yeah.
right? So we always want to optimize patients for the procedures.
So Came Shatrice, is Dr. Jeff aggressive with liposuction? If you want, I guess.
Oh, your patients ask me that. Do we
Yes.
do aggressive liposuction? I guess that's as opposed to lazy liposuction, right? So, yep, actually we are pretty aggressive because ultimately the goal, as I would say, is to reverse the curve, right? So we often have fullness, say, in the flank region, and then some patients have like minimal hips, and then we want to increase that in the buttock region. So we're reversing the curve, and you can only do that by being aggressive with your liposuction. So take a look at some of the things we've done online or on Instagram. You'll get a better impression of the things that we do here at Smart Plastic Surgery. But yes, you have to be not only aggressive, but also kind of have an artistic approach to, to the form, and also taking into account what the patient specifically wants. Because some patients say, they want to be, dramatic, which is great. Others want a skinny BBL or a more natural BBL. So we do each of these. And again, it's by having a conversation that we determine exactly what's best for each of you.
This is just K876. Can you do vitamin infusion before surgery?
I think that's reasonable. Depends on what the vitamin is, and is that a euphemism for something else? I don't know. But if it's true vitamins, I don't think that's a problem.
If it's vitamins.
If it's vitamins without quotes around it, we could probably do that. If there's any question, just give us a call or send a message and tell us exactly what you want to use, and we can approve that or give you our opinion. We're always happy to do that.
Okay. Famous Beauty Tech, when you put down your deposit, how long do I have to wait for surgery? I think it depends by when you schedule it. But you can put your deposit, schedule it, and then, that's the information I have. Eclipse 7. What do you recommend I should eat 2 weeks before my BBL?
That's a great question. All right, so I wouldn't do major, McDonald's Action 3, I wouldn't do that. There's no need to do that. Depending on hemoglobin, things like that. A couple steak dinners would never hurt.
Yes.
All right, taking iron for many of our patients is harmless and helpful to optimize your hemoglobin. There is a little bit of blood loss during these procedures, and if there's a concern at all for BBL or for other procedures, we also have cell saver technology that we use. So this is not a real issue for us. But as far as what you should eat, I would eat well. There's nothing to be concerned about. Steaks or red meat or green vegetables, things like that will increase your hemoglobin are always a good thing to do a couple weeks before surgery for sure.
So good, throw some good steaks there.
And I would recommend sushi, which is a favorite of mine.
Oh wow, nice. Let's see. So Miss Elisa, she's answering someone else. At least 30 days to get your labs taken. Labs have to be completed 15 to 30 days before your surgery.
Right, so typically not more than 30 days. Right, so it's within that 30-day period.
Beautiful. After a chin lipo, how long I will need to wear my face wrap?
Oh, that's a great question. So typically, like a lot of compression garments, 6 to 8 weeks for sure. All right. Now, in the first week, we really want you to wear it as much as possible. So you might be working from home or not going out. You can wear it just really all the time. After that, when you're back at work, you might want to wear something that looks like rabbit ears. So then, when you get home,
Rabbit ears?
well, they kind of come across, and they don't necessarily tie at the top, but they kind of you do look a little bit like a rabbit, in this garment, which is not a problem. But you may not want to wear that in public. So when you get home, I'd have you wear it in the house, wear it to bed. So wear it as much as possible because that's ultimately going to give you the best contour. Like any other part of the body, the neck is very visible.
And it helps with swelling, right?
It absolutely helps with swelling.
Yeah.
So all of these garments help with swelling. And that's how we get to the final result by improving the swelling. Depending on how diligent you are with wearing the compression garment, you're going to more rapidly, arrive at your final result. So a lot of it depends on patient compliance and enthusiasm for these garments, and that makes a real difference.
Yeah. It's like, I feel like when you take us out of the surgery, it's like putting us in the oven. So it's like, now you're ready to keep cooking the whole product.
Oh yeah, right. So it's not fully done yet, right?
Yeah,
so it's not fully done, right? It's not right. We don't just surgery is a part of it. It's a team effort, though, right? So we've got I'm there, you're there, we have the rest of the surgical team, but following surgery, it still remains a team
your
effort.
Your
family is
people
there, your
taking
significant
care.
others, that sort of thing. So keeping you in the
Massage
garments,
therapist.
coming to see us, going to have your massages, right? Not for the abdominal flap, right? But for all other areas following surgery. So this is all part of the team effort, and we follow you closely, especially shortly after surgery. As you know, we see patients like the next day and several days during the first week for those who are traveling. So that's very important.
We're going to take 2 more questions, and I think I have 2 very good questions here. 904, honey, how many follow-up appointments do you require? I guess.
Oh, I think it's like 86, isn't it? So we have or is it 120? So basically, we see you, immediately afterwards, and then for people who are, local, people who are traveling, we see them, a couple times within the first week. If you're having massages, you may be here, 5 days during that week to really get going before you leave or wherever you may be going. But otherwise, we'll follow you over the course of time, in person or virtually. We review photos, we have conversations.
And we really want you to feel completely satisfied. So you can request any follow-up appointment that you want. If you're here in Miami, come to the clinic, just call us, schedule your follow-up appointment. At least, we recommend at least 1. We have a lot of people traveling, but please make sure that you come
in
to your
person.
follow-up.
And then, of course, 3 months later, if you're here locally or you're traveling or coming through Miami, call us, come to the office, see us in person. We're always happy to do that.
Even if you're completely healed, you can come and say hi to us.
Take photos.
We love that.
Say hi.
That's a great question, 904,
That's a great question.
honey.
Yep.
And
We're always available.
So Lauren Page XX0, what are the best food to eat after BBL? We already talked about the ones before. Now she's asking about the.
Well, for me, it would be sushi. Okay, but after surgery, the thing we don't want to do is go straight to McDonald's, right? That defeats. When they asked Michael Jordan after
And
the
there's no
championships
energy
where
there
are you going,
either.
he would go to Disney World, right?
Yeah.
When we ask our patients, we don't want the response to be McDonald's, right? So we want to continue with a healthy diet. And in fact, for all of my patients following any body contouring procedure, my recommendation and my strong suggestion is that I want patients to lose like 10% of body weight over the following 6 months after surgery. So that's my goal. So whatever it takes to accomplish that, McDonald's is probably not going to be in that picture. I guess an occasional treat, I get it. But you really want to eat, eat well following surgery, and watch your diet, exercise, and all the things that we have been
And
promoting.
like immediately after, when you're recovering, we said no McDonald's, but I think also
immediately afterwards.
you have to eat
you do, but very light initially. Toast, things that are bland, so we don't have nausea. But we give everybody Zofran, which is the best anti-nausea medicine that we have really. So we really look out for each of these different things following surgery, and we know what to expect. But slowly over the next couple of days or so, we want to go back to more of a regular diet, but a healthy one, because ultimately that's going to give us the best result. It's part of being part of that team.
So yeah, you have to keep healthy, your body healthy. And okay, well, that was the answers from Dr. Jeff. Ask Dr. Jeff. We're gonna see you next Thursday.
Week. See you next Thursday.
And thank you for participating. Yeah, we have some more questions. You can also send us your questions.
We're happy to respond
on this post, and Dr. Jeff can keep
we'll
answering.
Collect them and answer them.
Okay. Awesome.
Thanks so much, guys.
Thank you.
We'll see you soon.
Bye.
Bye-bye.